Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, on this Patriot Day, a national day of service and remembrance, our topic is the World Trade Center Health Program, a national effort that pays for care for tens of thousands of first responders and community members injured in the aftermath of the terrorist attacks on September 11th. Dr. John Howard is director of the National Institute for Occupational Safety and Health at the Centers for Disease Control and Prevention. That's the agency that oversees this program. He joins Dr. Sharfstein to talk about its origins, how eligibility works, and how people can still register today. Please check out the link in the show notes to learn how to apply. Let's listen.
Dr. John Howard, thank you so much for joining Public Health on Call to talk about the CDC's World Trade Center Health Program. And I want to start by asking you how this program got started.
Well, that's a great place to start because a lot of people aren't aware of that. I think most people are aware of 9/11 occurring in New York City, at the Pentagon in Arlington, Virginia, and in a field near Shanksville, Pennsylvania. And that terrorist attack formed a lot of interest for folks in the Congress. They were very concerned about the responders who came and helped both rescue, cleanup, recovery, reconstruction. And we began to see very early on, 2001, right away, a thing called World Trade Center cough, where we had responders that were basically exhibiting these chronic cough symptoms. When you look at the dust, all you have to do is see some of those photos from September 11th, 2001, and you see people breathing that kind of air. It's not surprising that they would have a cough. And I think we became concerned about whether or not there was more than just a cough there.
And we're not talking about a small number of people who had exposures to dust and other potential hazards as part of the response.
Exactly. The estimates that we did early on in the early 2001, 2, and 3, upwards of 90,000 responders were involved at all three sites, and upward of 450,000 community members, especially in Lower Manhattan. Not a small number.
And so how do you go from the potential scale of the challenge and the interest in rising to the challenge to a program? What happens?
Well, it isn't easy because no one had really done this sort of thing before. No one had considered doing it in the Congress, and no one in the Department of Health and Human Services, where CDC is located, and the National Institute for Occupational Safety and Health, located in CDC. Nobody had thought of doing this program before. And it took a while. It took from 2001 to 2011. It took a full decade to develop the program that we have now, the World Trade Center Health Program.
And Congress authorized and funded this program. I think, is this the program that many people may remember Jon Stewart really advocating for?
Yes, Jon Stewart was a significant advocate for the program. And not only that, but there was a growth curve to interest in the program because clearly responders at the beginning, everybody saw them on TV. They were the ones that developed the World Trade Center cough initially. But the survivor population in the community wasn't really thought about or added in terms of interest in the program until about 2008, when the Congress offered financial support for us in the program to add them. So it was a growth curve from 2001 to 2011, both from the medical standpoint, as well as the program standpoint, the policy standpoint, the political standpoint.
And so what happens in 2011 after Congress passes this law? What does the program, as it's finally set up, look like?
Well, that's a really simple and a complex question to answer, because the program basically established the World Trade Center Health Program, which became an authorized program by the Congress in 2011. It basically said, well, you need to meet certain eligibility criteria. And the statute called the Zadroga Act spells out exactly which kind of responders can be eligible and which kinds of survivors or community members can be eligible for the program. So all of those were established by the Congress in the Zadroga Act. Once you became eligible for the benefits from the health plan itself, then you were covered for the conditions that the health plan covered. And they were of two varieties, both physical as well as mental. And there was a list in the statute of conditions. So on the physical side, it was primarily conditions of the respiratory system, both the upper, sinusitis, for instance, and the lower, asthma and interstitial lung disease. On the mental health side, depression, anxiety, PTSD, those were the conditions that were spelled out in the statute. But importantly, the Congress said, well, that may not be all of the conditions that these responders and community members may develop. So we're going to give authority to the administrator of the program to add conditions through time.
Got it. So Congress set the basic parameters, who's eligible, and gave an initial list of conditions for which the program would pay for treatment, and gave the CDC, NIOSH, and you as the administrator the ability to add other diseases if you believe that they could be linked to the exposures related to 9/11.
Exactly. And that latter issue, adding conditions, is, as you can imagine, a bit of a complex scientific project, because you have to have evidence that a condition is being seen in the responders and the community members, and you have to have some understanding of why it's occurring. So in the case of our program, I'll use one example. The first major type of conditions that we added very early on, 2012, was cancer. And the reason we added cancer is because, one, we made a list of all of the carcinogens that responders and community members were exposed to. As you can imagine, in a building like the Twin Towers, there was asbestos, a known carcinogen, as well as other chemicals that were associated with all of those computers, for instance, and the building materials. So we had a list of over 200 carcinogens. So we knew that people were exposed to cancer-causing agents. And then in research, a study that was done by the Fire Department of New York City in conjunction with several universities showed there was a greater incidence of cancer in the responders than in the general population. So as a result, then, we took advantage of the statute that said we could add new conditions if there was scientific support. We thought there was enough scientific support that we added cancer to the list. So that was an example of the statute moving through time.
Roughly how many other conditions have you added?
Well, to date, we've added most in fact, all of the cancers. We recently added our last type of cancer, which was uterine cancer, which was our last cancer type that we added. So now we cover all types of cancer. We've also looked at the research that's coming online, signals that we receive, because we also fund research. In addition to providing the health coverage for individuals, we fund researchers to look at the various exposures at our population, of which I might add now numbers 125,000 members. And we look to see, are there other conditions that look like they're coming online in terms of adding? And I'll mention a few: autoimmune disease, neuropathic changes, for instance, neuropathies. Those are two that we've seen a number of scientific reports lately that we're looking at very carefully.
For people who are eligible and they also develop one of the conditions, either that was in the law or has been added on the basis of evidence, what else do they have to show in order to qualify for benefits?
Very good question, because it contrasts our health plan with your normal health plan, your Blue Cross plan, your Aetna plan, your Medicare plan, your Medicaid plan, where you go to your doctor and your doctor diagnoses your condition. That's pretty much it. You're covered. For us, our members have to show that their exposures were sufficient to account for why they developed that cancer. So our program is a little different. And for your listeners who are familiar with workers' compensation insurance, it's very similar to workers' compensation insurance.
And so how do people show that? How do they demonstrate that their exposure was sufficient to cause the particular condition they have?
That's a question and answer interaction with the physician who is seeing the member and trying to figure out whether he or she can make that determination that the exposure is sufficient enough to account for that particular cancer. The program provides a number of procedural steps that the physician goes through. Where was the person working? How long were they working there? What particular time frame were they working there? Were they there on 9/11, the day, September 11th, 2001? Were they there for days or weeks or months afterwards? So all of those are factors determining their exposure profile.
Got it. So you said there are about 120,000 members of this program. How many people have actually received benefits? And what's the total expenditure on healthcare costs that you've had?
Well, our program has been generously supported by the Congress since 2001, and clearly since 2011, since the Zadroga Act was passed. So our budget, for instance, in this fiscal year, for patient care, for research, for other issues relative to our program, is nearly $800 million. So we spend our funds primarily on patient care costs. So once an individual's eligible and once a physician has made the determination that their condition is related to their exposure, then we cover all the costs associated with that particular condition, including what's unique about our program is there are no copays.
And it sounds like you're supporting the care of quite a lot of people who had this terrible exposure.
Right. You know, we have 125,000 members that are enrolled in our program, but not all of them are requiring patient care services at this time. We encourage all responders, and this is very important for any listener who may be a 9/11 responder or a community member in New York City, in Lower Manhattan, to sign up for our program, because you don't have to have a medical condition at the time that you become eligible. But we want you to be a member of our program. So if you need our program services in the future, you're already a member of our program.
Well, that's a very important message. And since you said that there were as many as 400,000 plus people who potentially were exposed, it sounds like there are some people out there.
There definitely are some people out there. Certainly in the community, the survivor community, as we call them in our program, of the 125,000, most of our members are responders. We don't have as many community members, but there is a large number that are eligible, as you say.
Well, I found a great deal of information about this at your website, and we'll put that in the show notes for people who want to learn more about the program. And Dr. Howard, I really want to thank you for joining me and explaining all this, and appreciate you and your staff for the work that you do for people who are first responders and community members on 9/11.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.